Cashy Hyde is only 3 years old, but he's already battled brain cancer twice. He lives in Montana and came to Southern California last October with his family for a specialized type of radiation treatment. But Cashy's parents didn't stop there. They freely admit they are breaking federal law by giving their toddler marijuana, and they believe it saved Cashy's life.
The doctors told us that Cashy was going to die.
Can you wave? Can you wave?
Was laying in bed shivering, shaking, his skin was peeling.
Cashy was so sick that he hadn't eaten in over 40 days.
At just 3 years of age, Cashy Hyde has spent most of his young life battling cancer.
On May of 2010, he was diagnosed with a stage 4 brain tumor.
His tumor is inoperable, inextricably wrapped around his optic nerve. In 2010, Cashy spent 10 months at a Salt Lake City hospital, enduring high-dose chemotherapy and a bone marrow transplant.
They asked us 6-7 times, if we wanted to quit efforts and just let him go.
He was vomiting 8 to 10 times a day. He was so sick he could barely lift his head off the pillow.
Cashy's parents, Mike and Callie Hyde, made a radical decision. They asked Cashy's doctors to take him off his anti-nausea and pain medications. Instead, Cashy's parents turned to this, cannabis oil, made from marijuana, a substance that is illegal under federal law. Mike and Callie, a registered nurse, began sneaking the cannabis oil into Cashy's feeding tube. They did not inform Cashy's oncologist.
Within 2 weeks' time, Cashy was off of all those drugs. He was sitting up in bed eating. He was laughing.
Mike and Callie say Cashy slept more and appeared to be in less pain, all of which seemed to help the toddler endure the grueling chemotherapy.
The doctors and nurses told us that was a miracle and amazing.
In January 2011, Mike and Callie say doctors told them Cashy was in remission.
Ride in the turtle. Ride the turtle.
But the family's joy was short-lived. An MRI in October of 2011 showed Cashy's tumor had returned.
That's when our second cancer fight started.
Marijuana is classified as a Schedule I drug by the U.S. government's Drug Enforcement Administration. That means the DEA believes marijuana has no currently accepted medical use and has a high potential for abuse. Trying to change that, the California Medical Association recently urged the federal government to make it easier for scientists to conduct more medical research on marijuana.
I think there is tremendous potential for using cannabinoids for treating cancer.
Cannabinoids are the chemical compounds unique to marijuana, or cannabis. It's there researchers like Dr. Prakash Nagarkoti of the University of South Carolina Medical School see the most promise. Dr. Nagarkoti and his team of researchers were among the first to show that the active compounds in cannabinoids can target a cancer cell, unlock the receptor, and direct the cancer cell to self-destruct.
When you inject marijuana cannabinoid called THC into mice, we found that almost 25 to 30% of the mice would reject that cancer or reject the tumor. The cells basically commit suicide.
Dr. Nagarkoti's results in mice are so promising, he's beginning human clinical trials with leukemia patients.
Cashy's not a criminal. Cashy just wants to live. Cashy wants to go outside and play.
Cashy's second bout with brain cancer brought the family here to Southern California last fall, to Loma Linda University Children's Hospital for 6 weeks of proton radiation.
You say your name's Cashy?
Once again, Mike and Callie did not tell Cashy's doctors about the cannabis oil, out of fear his treatment would be stopped.
It is federally illegal. All of these organizations and institutes are federally funded.
And they did not get Cashy a medical marijuana recommendation for California.
Prosecution is not my worry. Cashy turning 4 is my worry. If Cashy can turn 4 and I'm sitting in jail, that's fine.
Mike and Callie believe so strongly in the power of cannabis, they both admit they use marijuana. Callie, 6 months pregnant, told us off camera she is smoking marijuana for pregnancy-related nausea.
I just want to spread the word to other parents. They need to know, that he is flourishing on this medication.
Cashy's brain tumor shrunk by half during 6 weeks of radiation therapy at Loma Linda. But the potential for marijuana to act on cancerous tumors isn't known yet.
There just isn't an answer.
Dr. Donald Abrams is an oncologist at UC San Francisco.
Cannabis is felt to act in a number of different ways against tumors, one of which is by blocking angiogenesis or the creation of new blood vessels.
There's not enough valid research being done.
Cashy's battle with cancer is far from over, but it's a fight his family won't back down from.
Cashy has cancer, and we're fighting cancer. Cancer has no rules, and neither do I. Bye-bye.
Now some good news. It's been about 7 weeks since Cashy completed his radiation at Loma Linda. The tumor has continued to shrink. Cashy's parents say the MRI scans they got last week show the tumor is gone for now. He is in remission again. And you may have noticed Cashy's custom wheels. The Cashy Hyde Foundation buys those wagons, customizes them with IV poles and stickers, and donates them to hospitals. If you'd like more information, you can log on to our website, abc7.com.